Question 1. A nurse is caring for a client with a new prescription for warfarin. Which of the following laboratory values should the nurse monitor to evaluate the therapeutic effect of warfarin? A. Partial thromboplastin time, PTT. B. Activated partial thromboplastin time, APTT. C. Prothrombin time, PT, and international normalized ratio, INR. D. Platelet count. Answer, C. Prothrombin time, PT, and international normalized ratio, INR. The concept tested here is the monitoring of anticoagulant therapy, specifically with warfarin. The keyword warfarin is crucial, as it's an anticoagulant that affects the extrinsic pathway of the coagulation cascade. The PT and INR measure the time it takes for blood to clot, reflecting the effectiveness of warfarin. A normal PT is around 10 to 13 seconds, and the INR is typically between 0, 8 and 1, 2. Therapeutic levels for warfarin are usually higher, often 2, 0-3, 0 or 2, 5-3, 5, depending on the indication. For example, a client on warfarin for atrial fibrillation might have an INR goal of 2, 0-3, 0. This means the blood takes longer to clot compared to someone not on warfarin. Here's an easy way to remember it. Warfarin affects clotting time, and PT/INR are the tests that measure that effect. Question 2. A nurse is providing discharge instructions to a client newly diagnosed with type 2 diabetes mellitus. Which of the following statements by the client indicates a need for further teaching? A. I will check my blood sugar before each meal and at bedtime. B. I should eat a balanced diet and limit my intake of sugary foods and drinks. C. I will increase my physical activity to at least 30 minutes most days of the week. D. I can skip my medication if my blood sugar levels are within the normal range. Answer, D. I can skip my medication if my blood sugar levels are within the normal range. This question assesses understanding of diabetes management principles, particularly the importance of consistent medication adherence. The client's statement, skip my medication if my blood sugar levels are within the normal range, is the key indicator needing further instruction. Type 2 diabetes management requires consistent medication to maintain stable blood glucose levels and prevent long-term complications, regardless of occasional normal readings. For instance, oral hypoglycemic agents work to keep blood sugar controlled over time, not just when it spikes. Here's an easy way to remember it. Diabetes is a chronic condition, and daily medication is essential for ongoing management, not just for high readings. Question 3. A nurse is assessing a client who reports experiencing sudden onset of severe chest pain radiating to the left arm, shortness of breath, and diaphoresis. Which of the following actions should the nurse take first? A. Administer sublingual nitroglycerin. B. Administer oxygen at 2 to 4 liters per minute via nasal cannula. C. Obtain a 12-lead electrocardiogram, ECG. D. Administer aspirin 325 milligrams orally. Answer, C. Obtain a 12-lead electrocardiogram, ECG. This question addresses the priority assessment for a client suspected of having a myocardial infarction, MI, or heart attack. The keywords sudden onset of severe chest pain radiating to the left arm, shortness of breath, and diaphoresis are classic signs of an MI. According to the ABCs, airway, breathing, circulation, and immediate life-saving interventions, obtaining a 12-lead ECG is the highest priority to confirm the diagnosis and guide treatment. Oxygen is important, but the ECG is diagnostic. Nitroglycerin and aspirin are important treatments, but they are administered after or concurrently with the diagnostic ECG to determine the best course of action. For example, seeing ST segment changes on the ECG helps determine if the client is having an ST elevation MI, STEMI, which requires immediate reperfusion therapy. Here's an easy way to remember it. When it comes to chest pain, the ECG is your first diagnostic step to know what's happening with the heart. Question 4. A nurse is caring for a client with a new colostomy. The nurse should instruct the client to avoid which of the following foods initially after surgery? A. Cooked carrots. B. Applesauce. C. Yogurt. D. Brown rice. Answer: D. Brown rice. This question focuses on dietary recommendations for a client with a new colostomy, emphasizing foods that can cause blockages. The keyword new colostomy is important because the gastrointestinal tract needs time to heal and adjust. Foods high in fiber and difficult to digest, like brown rice, can be problematic initially as they may cause a blockage in the stoma, the surgically created opening. Cooked carrots, applesauce, and yogurt are generally well tolerated and easier to digest. For example, a large amount of high-fiber grain like brown rice could form a bulky stool that might clog the colostomy opening, leading to pain and potential complications. Here's an easy way to remember it. With a new colostomy, stick to softer, low-fiber foods until your system gets used to it. Question 5. A nurse is administering intravenous fluids to a client. Which of the following is the most accurate method for the nurse to verify the correct intravenous fluid and its rate of infusion? A. Reading the 4-bag label and the infusion pump setting. B. Asking the client if this is their usual 4 fluid. C. Checking the medication administration record, MAR, for the prescribed fluid and rate. D. Observing the drip rate manually in the drip chamber. Answer: C. Checking the medication administration record, MAR, for the prescribed fluid and rate. The core concept here is medication safety and the rights of medication administration, specifically the right solution and rate. The MAR is the legal document that details the prescribed medication, including the type of 4 fluid and the rate of infusion. While reading the 4-bag and infusion pump, option A, is essential for double-checking, the MAR is the primary source of truth for what should be administered. Asking the client, option B, is not a reliable verification method, and manual observation, option D, is prone to error and lacks precision for programmed rates. For instance, the MAR will specify 0.9% sodium chloride at 100 milliliters per hour, and the nurse must verify this against the 4-bag and pump. Here's an easy way to remember it. Always consult the official order, the MAR, first to ensure you have the correct 4 fluid and rate. Question 6. A nurse is caring for a client diagnosed with a deep vein thrombosis, DVT. The nurse understands that the primary goal of treatment for DVT is to prevent which of the following complications? A. Pulmonary edema. B. Pulmonary embolism. C. Deep tissue infection. D. Hemorrhage. Answer: B. Pulmonary embolism. This question focuses on the primary complication of a deep vein thrombosis, DVT, which is a blood clot in a deep vein, usually in the leg. The keyword primary goal of treatment is important. A DVT itself can cause pain and swelling in the affected limb, but the most life-threatening complication is a pulmonary embolism, PE, which occurs when a piece of the clot breaks off and travels to the lungs. Pulmonary edema is fluid in the lungs. Deep tissue infection is a localized infection, and hemorrhage is excessive bleeding, none of which are the primary complication prevented by DVT treatment. For example, if a clot from the leg detaches and travels to the lungs, it can block blood flow, causing a PE. Here's an easy way to remember it. The biggest danger with a DVT is that the clot might travel to your lungs. Question 7. A nurse is assessing a client's surgical incision. The nurse notes that the incision edges are separated, and there is a clear serous fluid draining from the wound. The client reports feeling a popping sensation at the incision site. Which of the following complications should the nurse suspect? A. Wound dehiscence. B. Surgical site infection. C. Seroma formation. D. Hematoma formation. Answer: A. Wound dehiscence. This question tests the recognition of wound complications, specifically wound dehiscence. Keywords like incision edges are separated, clear serous fluid draining, and the client's report of a popping sensation are classic indicators of dehiscence. Dehiscence is the partial or complete separation of the surgical incision. Surgical site infection typically involves purulent, pus-like, drainage and increased redness or warmth. Seroma and hematoma are fluid collections under the skin, which may cause swelling but not typically gaping or dehiscence. For instance, if the layers of the surgical wound split open, you might see the underlying tissue. Here's an easy way to remember it. A popping sensation and open edges mean the wound might have come apart. Question 8. A nurse is preparing to administer a medication via a nasogastric (NG) tube. Which of the following actions is essential before administering the medication? A. Check the NG tube for proper placement. B. Flush the NG tube with 30 milliliters of sterile water. C. Clamp the NG tube for 30 minutes after administration. D. Administer the medication through the aspiration port. Answer: A. Check the NG tube for proper placement. The critical concept here is patient safety when administering medications via a nasogastric tube. The most important step before any administration is verifying the tube's placement to ensure the medication enters the stomach and not the lungs, which could cause aspiration. The other options are either general post-administration procedures or incorrect. Flushing is done after administration to clear the tube, clamping is done after flushing, and medications are given through the main lumen, not typically an aspiration port unless specified for that purpose. For example, if the NG tube has migrated into the lungs, administering medication would be extremely dangerous. Here's an easy way to remember it. Always confirm the tube is where it's supposed to be before pushing anything through it. Question 9. A nurse is caring for a client who is experiencing nausea and vomiting. Which of the following interventions is most appropriate to manage the client's symptoms? A. Encourage the client to drink large amounts of fluid at once. B. Offer dry toast and crackers. C. Withhold all oral intake until nausea subsides. D. Administer an antiemetic medication as prescribed. Answer: D. Administer an antiemetic medication as prescribed. This question focuses on the management of nausea and vomiting, emphasizing the most effective intervention. The keyword most appropriate guides the nurse to the intervention that directly addresses the physiological cause of nausea. While offering bland foods like dry toast and crackers, option B, can help some people, and withholding intake, option C, might be necessary temporarily, an antiemetic medication to prevent vomiting, directly targets the nausea. Encouraging large fluid intake, option A, can often worsen nausea. For example, ondansetron, Zofran, is an antiemetic that blocks the action of serotonin in the brain, reducing the urge to vomit. Here's an easy way to remember it. When you feel sick to your stomach, medicine designed to stop vomiting is usually the quickest and most effective solution. Question 10. A nurse is educating a client about the importance of fluid intake for preventing kidney stones. Which of the following statements by the client indicates an understanding of the teaching? A. I should drink 8 ounces of fluid per day. B. I should drink fluid primarily when I feel thirsty. C. I should aim to drink 2 to 3 liters of fluid daily. D. I should avoid drinking fluids before bedtime. Answer: C. I should aim to drink 2 to 3 liters of fluid daily. The concept tested is fluid management for kidney stone prevention. The keyword kidney stones and the need to prevent them are crucial. Adequate hydration dilutes urine, making it less likely for stone-forming substances to crystallize. Drinking 2 to 3 liters of fluid daily is the standard recommendation for this purpose. Drinking only when thirsty, option B, is not proactive enough, and limiting fluids, options A and D, can actually increase the risk of stones. For example, drinking enough water helps keep the urine clear, meaning less concentration of stone-forming minerals like calcium oxalate. Here's an easy way to remember it. Staying well hydrated, around 2 to 3 liters a day, is your best defense against kidney stones. Question 11. A nurse is admitting a client with suspected sepsis. Which of the following assessment findings is the most concerning? A. Blood pressure 90/50 mmHg. B. Heart rate 110 beats/min. C. Respiratory rate 22 breaths/min. D. Temperature 100 for degree F, 38 degree C. Answer: A. Blood pressure 90/50 mmHg. This question tests the recognition of critical signs of sepsis, a life-threatening condition caused by the body's overwhelming response to infection. The keywords suspected sepsis and most concerning are important. Sepsis can lead to septic shock, characterized by dangerously low blood pressure, hypotension, while an elevated heart rate, tachycardia, slightly elevated respiratory rate, and fever are common signs. A blood pressure of 90/50 millimeter of mercury is significantly low and indicates potential circulatory collapse, a hallmark of septic shock. For example, a blood pressure this low means vital organs may not be receiving enough oxygenated blood. Here's an easy way to remember it. In sepsis, a drop in blood pressure is a critical warning sign that the body is struggling to stay stable. Question 12. A nurse is reviewing the laboratory results for a client with suspected iron deficiency anemia. Which of the following findings would the nurse expect? A. Elevated white blood cell count. B. Decreased hemoglobin and hematocrit. C. Increased platelet count. D. Elevated serum calcium level. Answer: B. Decreased hemoglobin and hematocrit. This question relates to the expected laboratory findings in iron deficiency anemia, a condition where the body lacks enough iron to produce adequate hemoglobin. The keywords iron deficiency anemia and expect are key. Hemoglobin is the protein in red blood cells that carries oxygen, and hematocrit is the percentage of blood volume made up of red blood cells. In iron deficiency anemia, both hemoglobin and hematocrit levels are typically low because there isn't enough iron to make hemoglobin, leading to fewer and smaller red blood cells. The other options are not direct indicators of iron deficiency anemia. For example, a low hemoglobin means less oxygen can be carried to the body's tissues. Here's an easy way to remember it. Anemia means you have too few red blood cells, which leads to low hemoglobin and hematocrit. Question 13. A nurse is providing care for a client who has undergone a thyroidectomy. The nurse should monitor the client for which of the following potential postoperative complications? A. Hypoglycemia. B. Hypocalcemia. C. Hyperglycemia. D. Hyperkalemia. Answer B. Hypocalcemia. This question assesses knowledge of potential complications following a thyroidectomy, surgical removal of the thyroid gland D. The thyroid gland is near the parathyroid glands, which regulate calcium levels. Accidental removal or damage to the parathyroid glands during thyroid surgery can lead to hypocalcemia, a condition of abnormally low calcium levels. Hypoglycemia, low blood sugar, hyperglycemia, high blood sugar, and hyperkalemia, high potassium, are not direct or common complications of thyroidectomy. For example, if the parathyroid glands are damaged, the body won't be able to produce enough parathyroid hormone, PTH, which is essential for maintaining normal calcium levels. Here's an easy way to remember it. Be watchful for low calcium after thyroid surgery because those tiny glands nearby are easily affected. Question 14. A nurse is caring for a client with newly diagnosed glaucoma. The nurse should instruct the client that glaucoma is characterized by which of the following? A. Clouding of the lens. B. Inflammation of the iris. C. Increased intraocular pressure. D. Detachment of the retina. Answer C. Increased intraocular pressure. This question targets the definition and underlying pathology of glaucoma. The keyword glaucoma and the phrase characterized by point to its primary feature. Glaucoma is an eye disease that damages the optic nerve, often caused by abnormally high pressure inside the eye, known as increased intraocular pressure, IOP. Clouding of the lens is cataracts, inflammation of the iris is iritis, and retinal detachment is a separate condition. For instance, the fluid inside the eye normally drains out, but in glaucoma, this drainage is blocked, causing pressure to build up. Here's an easy way to remember it. Think of glaucoma as too much pressure building up inside your eye, which can damage your vision. Question 15. A nurse is assessing a client who has been taking furosemide for several weeks. The nurse should monitor which of the following electrolyte levels, as it is commonly depleted by furosemide? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Answer B. Potassium. This question assesses knowledge about the common side effects of loop diuretics like furosemide. The keyword furosemide is critical, as it is a potent diuretic that promotes the excretion of electrolytes, with potassium being the most frequently affected. Potassium is an essential electrolyte for nerve and muscle function, including the heart. Low potassium levels, known as hypokalemia, can lead to serious cardiac arrhythmias. Sodium, calcium, and magnesium can also be affected, but potassium depletion is the most common and clinically significant adverse effect. For example, furosemide makes the kidneys excrete more salt and water, and potassium often gets lost along with them. Here's an easy way to remember it. Furosemide is a K+, potassium, wasting diuretic, so keep an eye on that electrolyte. Question 16. A nurse is caring for a client with a respiratory rate of 30 breaths/min, shallow respirations, and use of accessory muscles. The client also reports feeling short of breath. Which of the following actions should the nurse take first? A. Administer a bronchodilator. B. Encourage deep breathing exercises. C. Place the client in a high Fowler's position. D. Assess the client's oxygen saturation. Answer D. Assess the client's oxygen saturation. The question describes a client experiencing significant respiratory distress. The keywords respiratory rate of 30 breaths/min, shallow respirations, use of accessory muscles, and short of breath indicate potential hypoxia, low oxygen levels. According to the ABC, airway, breathing, circulation, Principle: assessing oxygenation status is the immediate priority. While other interventions like positioning, bronchodilators, and deep breathing exercises might be necessary, knowing the client's oxygen saturation is crucial to guide further treatment and confirm the severity of the breathing problem. For instance, a low oxygen saturation reading would indicate the urgent need for supplemental oxygen. Here's an easy way to remember it. Before you can help someone breathe better, you need to know how much oxygen they're actually getting. Question 17. A nurse is caring for a client with a newly placed chest tube for a pneumothorax. The nurse should instruct the client to avoid which of the following actions? A. Taking deep breaths. B. Coughing forcefully. C. Turning from side to side. D. Ambulating with assistance. Answer: B. Coughing forcefully. This question focuses on post-chest tube insertion care for a pneumothorax, collapsed lung. The keywords chest tube and pneumothorax are important. A chest tube is inserted to re-expand the lung by removing air or fluid. While deep breathing, option A, and turning, option C, are generally encouraged to help lung expansion, and ambulating, option D, promotes circulation, forcefully coughing, option B, can increase intrathoracic pressure and potentially dislodge the chest tube or cause pain. The goal is to clear secretions without compromising the chest tube's position or the lung. For example, a forceful cough can create a strong pressure change that might pull the chest tube out of place. Here's an easy way to remember it. You want to help the lung re-expand, but avoid coughing so hard that you might dislodge the tube. Question 18. A nurse is caring for a client experiencing symptoms of a panic attack. Which of the following interventions is most appropriate for the nurse to implement during the acute phase of the panic attack? A. Encourage the client to talk about their fears. B. Provide a quiet, calm environment. C. Teach relaxation techniques immediately. D. Leave the client alone to process their feelings. Answer: B. Provide a quiet, calm environment. This question addresses the immediate management of a panic attack, a sudden episode of intense fear. The keywords panic attack and acute phase indicate the need for immediate, supportive interventions. During a panic attack, the client is overwhelmed and cannot effectively process complex information or verbalize fears. Providing a quiet, calm environment, option B, helps reduce external stimuli and promotes a sense of safety. Talking about fears, option A, or teaching relaxation techniques, option C, is more appropriate once the acute phase has passed. Leaving the client alone, option D, can increase their feelings of abandonment and fear. For example, a loud, busy room can amplify the client's feeling of being out of control. Here's an easy way to remember it. When someone is in the grip of a panic attack, the first step is to make their immediate surroundings as safe and calm as possible. Question 19. A nurse is caring for a client who has undergone a knee arthroscopy. Which of the following instructions is most important for the nurse to provide regarding postoperative care? A. Apply a warm compress to the surgical site daily. B. Elevate the affected leg when resting. C. Begin range of motion exercises immediately after surgery. D. Restrict fluid intake to prevent swelling. Answer: B. Elevate the affected leg when resting. The question focuses on essential postoperative care for a knee arthroscopy, a minimally invasive surgical procedure on the knee joint. The keyword most important highlights the priority instruction. Elevating the affected leg, option B, is crucial for reducing swelling and pain by promoting venous return and preventing fluid accumulation in the surgical site. Applying warm compresses, option A, is generally avoided early post-op as it can increase swelling, cold therapy is preferred. Immediate range of motion exercises, option C, might not be appropriate depending on the specific procedure performed, and restricting fluid intake, option D, is unnecessary and potentially harmful. For instance, elevating the leg above heart level helps gravity drain excess fluid away from the knee. Here's an easy way to remember it. Keeping your operated leg up helps reduce swelling and makes your recovery more comfortable. Question 20. A nurse is assessing a client with a suspected urinary tract infection, UTI. Which of the following symptoms is most characteristic of a UTI? A. Flank pain. B. Suprapubic pain. C. Generalized abdominal discomfort. D. Lower back pain. Answer B. Suprapubic pain. This question aims to identify the classic symptom of a urinary tract infection, UTI. The keyword UTI and the phrase most characteristic are important. A UTI typically causes inflammation and infection in the bladder, leading to pain or discomfort in the suprapubic area, the region just above the pubic bone. Flank pain or CVA, costovertebral angle, tenderness usually indicates an infection that has ascended to the kidneys, pyelonephritis. Generalized abdominal discomfort and lower back pain can be associated with UTIs but are less specific than suprapubic pain. For example, the bladder is located in the suprapubic region, so inflammation there causes pain in that area. Here's an easy way to remember it. Pain right above your pubic bone is the classic sign that your bladder might be infected. Question 21. A nurse is caring for a client with a history of deep vein thrombosis, DVT. The nurse should instruct the client to avoid which of the following activities that could increase the risk of clot formation? A. Wearing loose-fitting clothing. B. Prolonged sitting or standing. C. Maintaining good hydration. D. Gentle walking. Answer B. Prolonged sitting or standing. The question focuses on preventive measures for clients with a history of deep vein thrombosis, DVT. The keywords history of DVT and increase the risk of clot formation guide the answer. Prolonged immobility, such as sitting or standing for extended periods, leads to blood pooling in the veins of the legs, which can increase the risk of clot formation. Wearing loose-fitting clothing, option A, maintaining hydration, option C, and gentle walking, option D, are all measures that help prevent DVT. For example, sitting for hours on a long flight without moving your legs increases your risk of developing a DVT. Here's an easy way to remember it. Movement is key to preventing clots. Avoid staying still for too long. Question 22. A nurse is assessing a client who is prescribed an opioid analgesic for pain management. Which of the following side effects is most important for the nurse to monitor? A. Euphoria. B. Constipation. C. Increased energy levels. D. Dilated pupils. Answer B. Constipation. This question assesses the common and significant side effects of opioid analgesics. The keyword opioid analgesic is crucial. Opioids work by binding to opioid receptors in the central nervous system, which can also affect the gastrointestinal tract by slowing down bowel motility, leading to constipation. While euphoria, A, can occur, it's not the most consistently monitored adverse effect. Increased energy levels, C, are the opposite of a typical opioid effect, and pupils typically constrict, meiosis, not dilate, D, with opioid use. For example, a client taking morphine for chronic pain will likely experience reduced bowel movements. Here's an easy way to remember it. Opioids tend to slow things down, including your digestion, so watch out for constipation. Question 23. A nurse is caring for a client with heart failure. The nurse should monitor which of the following laboratory values that would indicate an exacerbation of heart failure? A. Increased serum albumin. B. Decreased serum sodium. C. Decreased blood urea nitrogen, BUN. D. Increased hemoglobin. Answer, B. Decreased serum sodium. The question asks to identify a laboratory finding indicative of worsening heart failure. Heart failure means the heart isn't pumping blood effectively, leading to fluid retention. This fluid retention can dilute the body's electrolytes, including sodium, causing a decrease in serum sodium levels, hyponatremia. Increased serum albumin, A, would suggest better nutritional status. Decreased BUN, C, might indicate good hydration or kidney function, and increased hemoglobin, D, would indicate better oxygen carrying capacity. For example, when the body retains fluid due to poor heart function, the concentration of sodium in the blood can drop. Here's an easy way to remember it. In heart failure, the body often holds onto extra fluid, which can dilute the sodium in your blood. Question 24. A nurse is assessing a client diagnosed with hyperthyroidism. Which of the following findings would the nurse expect? A. Bradycardia. B. Weight gain. C. Tremors. D. Cold intolerance. Answer, C. Tremors. This question tests the understanding of the signs and symptoms associated with hyperthyroidism, a condition where the thyroid gland produces too much thyroid hormone. The keyword hyperthyroidism is key. Excess thyroid hormone speeds up the body's metabolism, leading to symptoms like weight loss, increased heart rate, tachycardia, heat intolerance, and neurological effects such as tremors. Bradycardia, slow heart rate, and weight gain are typically associated with hypothyroidism, underactive thyroid E. Cold intolerance is also a sign of hypothyroidism. For instance, the increased metabolism from excess thyroid hormone can cause a person's hands to shake. Here's an easy way to remember it. Too much thyroid hormone makes your body run too fast, leading to things like shaking and nervousness. Question 25. A nurse is caring for a client who has undergone a cataract extraction. Which of the following postoperative instructions is most important to prevent infection? A. Apply an eye patch continuously for 24 hours. B. Use prescribed antibiotic eye drops as directed. C. Avoid strenuous activity for 4 weeks. D. Restrict fluid intake. Answer, B. Use prescribed antibiotic eye drops as directed. The question focuses on crucial postoperative care after cataract surgery, specifically regarding infection prevention. The keywords cataract extraction and prevent infection are vital. Antibiotic eye drops are prescribed to prevent bacterial infection in the surgical site of the eye. While applying an eye patch, A, protects the eye, avoiding strenuous activity, C, helps prevent increased intraocular pressure and trauma, and restricting fluids, D, is not related to infection prevention. For example, the antibiotic drops directly target any bacteria that might have entered the eye during or after surgery. Here's an easy way to remember it. To keep your healing eye safe from germs, use those antibiotic drops exactly as the doctor tells you. Question 26. A nurse is caring for a client with asthma. The client is experiencing an acute asthma exacerbation. Which of the following medications is the most appropriate first-line treatment for immediate relief of bronchospasm? A. Inhaled corticosteroid. B. Long-acting beta-agonist, LABA. C. Short-acting beta-agonist, SABA. D. Anticholinergic inhaler. Answer, C. Short-acting beta agonist, SABA. This question assesses the knowledge of acute asthma management. The keywords asthma exacerbation and immediate relief of bronchospasm are critical. Short-acting beta agonists, SABAs, such as albuterol, are bronchodilators that relax the smooth muscles of the airways, providing rapid relief of bronchoconstriction during an asthma attack. Inhaled corticosteroids, A, are maintenance medications for long-term control, not for acute relief. LABAs, B, are also for maintenance and should not be used alone for acute symptoms. Anticholinergics, D, can be used in asthma exacerbations, but SABAs are generally considered the first-line rapid-acting treatment. For example, when someone with asthma starts wheezing and struggling to breathe, an albuterol inhaler quickly opens up their airways. Here's an easy way to remember it. For quick relief of an asthma attack, a rescue inhaler with a SABA is your go-to. Question 27. A nurse is assessing a client who is receiving warfarin. Which of the following statements by the client requires immediate intervention by the nurse? A. I started taking a new herbal supplement. B. I have been eating more leafy green vegetables. C. I occasionally miss a dose of my medication. D. I notice my urine is turning a darker color. Answer. A. I started taking a new herbal supplement. This question probes the potential interactions with warfarin, an anticoagulant. The keyword warfarin and requires immediate intervention are key. Many herbal supplements can interact with warfarin, either increasing its anticoagulant effect, raising the risk of bleeding, or decreasing it. Leafy green vegetables, B, contain vitamin K, which can interfere with warfarin, but this interaction is usually managed by consistent intake. Missing a dose, C, is a compliance issue that needs addressing but not necessarily immediate intervention unless the client is also symptomatic of over or under anticoagulation. Darker urine, D, can have many causes unrelated to warfarin, but some medications can cause it. However, new herbal supplements pose a significant and immediate risk of interaction. For instance, St. John's wort, a common herbal supplement, can decrease the effectiveness of warfarin. Here's an easy way to remember it. When you're on warfarin, be extremely cautious about starting any new supplements because they can cause dangerous interactions. Question 28. A nurse is caring for a client with pneumonia. The client has a persistent cough producing thick, greenish sputum. Which of the following interventions is most appropriate for the nurse to implement? A. Encourage increased fluid intake. B. Administer cough suppressants. C. Discourage coughing and deep breathing. D. Keep the head of the bed flat. Answer. A. Encourage increased fluid intake. This question focuses on managing sputum production in a client with pneumonia. The keywords pneumonia and thick, greenish sputum indicate a need to thin the secretions for easier expectoration. Encouraging increased fluid intake, option A, helps to liquefy thick mucus, making it easier to cough up and clear the airways. Cough suppressants, B, are generally avoided when sputum production is productive, as coughing is necessary to clear the lungs. Discouraging coughing, C, would be counterproductive, and keeping the head of the bed flat, D, can hinder lung expansion. For example, drinking plenty of water helps to make the thick mucus less sticky and easier to expel from the lungs. Here's an easy way to remember it. For thick mucus, fluids are your best friend to help loosen it up. Question 29. A nurse is caring for a client who has just undergone a colonoscopy. The nurse should assess the client for which of the following potential complications? A. Decreased bowel sounds. B. Rectal bleeding. C. Constipation. D. Abdominal distension. Answer B. Rectal bleeding. The question concerns potential complications following a colonoscopy, a procedure that visualizes the colon using a scope. The keyword colonoscopy and the need to assess for potential complications are important. While some gas and bloating, abdominal distension, option D, can occur temporarily due to air introduced during the procedure, and bowel sounds, A, might be temporarily altered, significant rectal bleeding is a more serious complication that requires immediate attention. Constipation, C, is not a typical immediate post-procedure complication. Bleeding can occur if a polyp was removed or if the colon wall was injured. For instance, if a polyp was removed during the colonoscopy, there might be some minor bleeding, but significant bleeding is a concern. Here's an easy way to remember it. After a colonoscopy, watch for any bleeding from the rectum, as it can indicate a problem. Question 30. A nurse is caring for a client with a diagnosis of heart failure. The nurse should assess for which of the following signs of fluid overload? A. Dry mucous membranes. B. Decreased urine output. C. Sunken eyes. D. Increased skin turgor. Answer B. Decreased urine output. This question focuses on identifying signs of fluid overload in a client with heart failure. Heart failure means the heart is not pumping effectively, leading to fluid buildup in the body. Decreased urine output, option B, is a key indicator that the kidneys are not effectively filtering excess fluid, often due to reduced blood flow from the failing heart or activation of the renin-angiotensin-aldosterone system that promotes sodium and water retention. Dry mucous membranes, A, sunken eyes, C, and increased skin turgor, D, are all signs of dehydration or fluid deficit, the opposite of fluid overload. For example, if the kidneys aren't filtering fluid properly, less fluid will be excreted as urine. Here's an easy way to remember it. When your body has too much fluid, your kidneys try to hold on to it, leading to less urine. Question 31. A nurse is administering a subcutaneous injection. Which of the following is the most appropriate needle angle for administration into the subcutaneous tissue? A. 15 degrees. B. 30 degrees. C. 45 degrees. D. 90 degrees. Answer D. 90 degrees. This question addresses the proper technique for administering a subcutaneous injection. The keywords subcutaneous injection and needle angle are crucial. Subcutaneous tissue is the fatty layer just beneath the skin. A 90-degree angle is generally used for subcutaneous injections with a standard needle length, e.g., 3/8 to 5/8 inch, especially if there is adequate subcutaneous tissue. A 45-degree angle might be used if the client is very thin or if a longer needle is used. 15 and 30 degrees are typically used for intramuscular injections, depending on the needle length and client size. For example, to inject insulin into the fatty layer of the abdomen, you would typically insert the needle straight in at 90 degrees. Here's an easy way to remember it. For the fatty layer under the skin, a straight poke, 90 degrees, is usually best. Question 32. A nurse is caring for a client who is experiencing a myocardial infarction, MI. Which of the following medications is typically administered first to relieve chest pain and improve myocardial oxygen supply? A. Metoprolol. B. Aspirin. C. Nitroglycerin. D. Heparin. Answer C. Nitroglycerin. The question is about the initial management of chest pain during a myocardial infarction, MI. The keywords myocardial infarction and relieve chest pain and improve myocardial oxygen supply point to the therapeutic action. Nitroglycerin is a vasodilator that helps to relax and widen blood vessels, including the coronary arteries, which can increase blood flow to the heart muscle and reduce chest pain. Aspirin, B, is an antiplatelet agent that prevents clot formation. Metoprolol, A, is a beta blocker that reduces the heart's workload, and heparin, D, is an anticoagulant. While these are also important treatments, nitroglycerin directly addresses the immediate symptoms of reduced oxygen supply causing chest pain. For instance, nitroglycerin can quickly dilate the coronary arteries, allowing more oxygen-rich blood to reach the heart muscle. Here's an easy way to remember it. Nitroglycerin is often the first medication given for chest pain because it helps open up the heart's arteries. Question 33. A nurse is caring for a client with a fractured femur. The nurse should be alert for which of the following potential complications? A. Hypoglycemia. B. Pneumonia. C. Fat embolism syndrome. D. Urinary tract infection. Answer, C. Fat embolism syndrome. This question focuses on the specific complications that can arise from a fractured femur. The keywords fractured femur and potential complications are crucial. A fracture of a long bone like the femur can lead to the release of fat globules from the bone marrow into the bloodstream. These fat globules can then travel to the lungs and other organs, causing fat embolism syndrome, a serious condition characterized by respiratory distress, petechial rash, and neurological changes. Hypoglycemia, pneumonia, and UTIs are not directly or primarily associated with femur fractures, although they can occur in any immobilized patient. For example, a fracture in the thigh bone can allow fatty marrow to enter the bloodstream. Here's an easy way to remember it. Broken long bones, especially the femur, carry a risk of fat breaking off into the bloodstream. Question 34. A nurse is caring for a client receiving a blood transfusion. Which of the following vital sign changes would be most indicative of a transfusion reaction? A. Decreased temperature. B. Increased pulse rate. C. Decreased respiratory rate. D. Decreased blood pressure. Answer, D. Decreased blood pressure. This question assesses the ability to recognize signs of a blood transfusion reaction. The keywords blood transfusion and transfusion reaction are important. A common and serious type of transfusion reaction is a hemolytic reaction, where the recipient's antibodies attack the transfused red blood cells. This can lead to a cascade of events including vasodilation and fluid shifts, often resulting in a precipitous drop in blood pressure, hypotension. While other vital signs might change, e.g., increased pulse, hypotension is a critical and early indicator of a severe reaction. Decreased temperature, A, is not typical, often, fever occurs. Increased respiratory rate, C, can occur, but decreased BP is more specific for a severe reaction. For example, a rapid drop in blood pressure signifies that the body is going into shock. Here's an easy way to remember it. A sudden drop in blood pressure during a transfusion is a major red flag that something is seriously wrong. Question 35. A nurse is caring for a client with atrial fibrillation. The nurse understands that the primary risk associated with atrial fibrillation is the development of which complication? A. Respiratory failure. B. Stroke. C. Gastrointestinal bleeding. D. Renal failure. Answer, B. Stroke. This question tests the understanding of the major complication associated with atrial fibrillation, an irregular and often rapid heart rhythm. The keywords atrial fibrillation and primary risk are important. In atrial fibrillation, the upper chambers of the heart, atria, quiver instead of contracting effectively, which can cause blood to pool and form clots. These clots can then travel to the brain, causing an ischemic stroke. Respiratory failure, GI bleeding, and renal failure are not the primary risks directly associated with the irregular heart rhythm of atrial fibrillation. For instance, blood can stagnate in the atria, creating a breeding ground for clots that can break off and travel to the brain. Here's an easy way to remember it. The main danger with atrial fibrillation is that clots can form and cause a stroke. Question 36. A nurse is caring for a client with dehydration. Which of the following assessments would be most indicative of severe dehydration? A. Mild thirst. B. Dry oral mucous membranes. C. Decreased skin turgor. D. Decreased urine output and concentrated urine. Answer: D. Decreased urine output and concentrated urine. This question focuses on identifying signs of severe dehydration. The keywords dehydration and severe are critical. While mild thirst, dry mucous membranes, and decreased skin turgor are all signs of dehydration, they can be present in milder forms. Significantly decreased urine output and highly concentrated urine, indicating the kidneys are trying to conserve water, are strong indicators of severe dehydration. The body is attempting to preserve essential fluids when it's severely depleted. For example, if someone is severely dehydrated, their kidneys will drastically reduce urine production to keep as much water in the body as possible. Here's an easy way to remember it. When your body is critically low on fluid, its main priority is to stop releasing any more water, shown by very little, very concentrated urine. Question 37. A nurse is teaching a client about managing hypertension. Which of the following lifestyle modifications should the nurse emphasize as most beneficial? A. Increasing sodium intake. B. Limiting alcohol consumption. C. Engaging in prolonged, high-intensity exercise daily. D. Reducing potassium intake. Answer: B. Limiting alcohol consumption. This question assesses knowledge of lifestyle modifications for managing hypertension, high blood pressure. The keywords managing hypertension and most beneficial are key. Excessive alcohol intake can raise blood pressure. Limiting alcohol consumption, along with reducing sodium intake, increasing potassium intake, regular moderate exercise, and weight management, are all beneficial lifestyle changes. Increasing sodium intake, A. Avoiding exercise, C. And reducing potassium intake, D. Are all contrary to recommendations for hypertension management. For example, drinking too much alcohol can cause blood vessels to constrict, raising blood pressure. Here's an easy way to remember it. Cutting back on alcohol is a really important step in lowering your blood pressure. Question 38. A nurse is assessing a client recovering from surgery. The client reports experiencing sharp, stabbing chest pain that increases with inspiration. This symptom is most suggestive of which of the following conditions? A. Myocardial infarction. B. Pulmonary embolism. C. Gastritis. D. Anxiety. Answer: B. Pulmonary embolism. The question describes a specific type of chest pain and asks for the most likely cause. The keywords sharp, stabbing chest pain, and increases with inspiration, pleuritic chest pain, are classic indicators of a pulmonary embolism, PE, which is a blood clot that travels to the lungs. While myocardial infarction, MI, causes chest pain, it's typically described as crushing or pressure-like and may not worsen with breathing. Gastritis is stomach inflammation, and anxiety can cause chest pain, but the specific description points more strongly to a PE. For instance, when a blood clot lodges in the lungs, it can cause irritation to the lung lining, making breathing painful. Here's an easy way to remember it. Chest pain that gets worse when you take a deep breath is a major warning sign for a blood clot in the lungs. Question 39. A nurse is caring for a client with diabetic ketoacidosis, DKA. Which of the following electrolyte imbalances is most commonly associated with DKA? A. Hyperkalemia. B. Hypokalemia. C. Hyponatremia. D. Hypocalcemia. Answer: A. Hyperkalemia. This question focuses on the electrolyte imbalances that occur in diabetic ketoacidosis, DKA, a serious complication of diabetes characterized by high blood sugar and ketones. The keywords diabetic ketoacidosis and electrolyte imbalances are important. In DKA, there is a shift of potassium from the intracellular space to the extracellular space due to acidosis and the lack of insulin, leading to elevated serum potassium levels, hyperkalemia, even though the total body potassium may be depleted. Insulin deficiency prevents glucose and potassium from entering cells. Hypokalemia, B, is a risk during treatment as insulin shifts potassium back into cells. Hyponatremia, C, and hypocalcemia, D, are not the primary electrolyte disturbances. For example, the acidic state in DKA causes potassium to move out of the cells into the bloodstream. Here's an easy way to remember it. In DKA, your blood potassium level is often high because the acid and lack of insulin push it out of your cells. Question 40. A nurse is caring for a client diagnosed with cirrhosis of the liver. The nurse should monitor for which of the following signs of hepatic encephalopathy? A. Jaundice. B. Ascites. C. Asterixis. D. Spider angiomas. Answer: C. Asterixis. This question tests the recognition of a specific neurological sign of hepatic encephalopathy, a complication of liver disease where toxins build up in the blood and affect brain function. The keywords cirrhosis and hepatic encephalopathy are key. Asterixis, also known as flapping tremor, is a characteristic sign where the client is unable to maintain a fixed posture with outstretched hands, causing them to involuntarily flap. Jaundice, A, is yellowing of the skin and eyes due to bilirubin buildup. Ascites, B, is fluid accumulation in the abdomen, and spider angiomas, D, are small, red, spider-like blood vessels on the skin. While these are all signs of liver disease, asterixis specifically indicates impaired brain function due to toxin buildup. For example, the flapping tremor occurs because the liver can't clear waste products from the blood, and these toxins affect the brain. Here's an easy way to remember it. That distinctive flapping tremor is a key sign that the liver isn't cleaning the blood well enough for the brain. Question 41. A nurse is caring for a client with a new prescription for a beta blocker. The nurse should instruct the client to monitor for which of the following adverse effects? A. Increased heart rate. B. Decreased blood pressure. C. Increased appetite. D. Dilated pupils. Answer: B. Decreased blood pressure. This question focuses on the common adverse effects of beta blockers, a class of medications used to treat various cardiovascular conditions. The keywords beta blocker and adverse effects are important. Beta blockers work by blocking the effects of adrenaline on the heart and blood vessels, which leads to a slowing of the heart rate and a decrease in blood pressure. An increased heart rate, A, is the opposite of the intended effect. Increased appetite, C, and dilated pupils, D, are not typical side effects of beta blockers. For example, beta blockers like propranolol are given to lower blood pressure by making the heart beat slower and with less force. Here's an easy way to remember it. Beta blockers tend to slow down your heart and lower your blood pressure. Question 42. A nurse is caring for a client experiencing a hypertensive emergency. Which of the following findings would the nurse expect? A. Blood pressure of 120/80 mmHg. B. Heart rate of 60 beats/min. C. Blood pressure greater than 180/120 mmHg. D. Clear lung sounds. Answer, C. Blood pressure greater than 180/120 mmHg. This question pertains to the definition of a hypertensive emergency, a critical condition where blood pressure rises to dangerously high levels and can cause organ damage. The keywords hypertensive emergency and expect are crucial. A hypertensive emergency is generally defined by a systolic blood pressure greater than 180 mm of mercury and or a diastolic blood pressure greater than 120 mm of mercury, often with signs of target organ damage. A blood pressure of 120/80 mmHg, A, is normal. A heart rate of 60 beats/min, B, might be low or normal. Clear lung sounds, D, are a normal finding and don't directly indicate the presence or absence of a hypertensive emergency. Organ damage could manifest in other ways. For example, an extremely high blood pressure reading puts immense strain on blood vessels throughout the body. Here's an easy way to remember it. A blood pressure reading that is very, very high is the defining feature of a hypertensive emergency. Question 43. A nurse is caring for a client with newly diagnosed Cushing's syndrome. Which of the following is a characteristic clinical manifestation of Cushing's syndrome? A. Weight loss. B. Increased skin pigmentation. C. Moon face and buffalo hump. D. Hypotension. Answer, C. Moon face and buffalo hump. This question focuses on the characteristic signs of Cushing's syndrome, a disorder caused by prolonged exposure to high levels of cortisol. The keywords Cushing's syndrome and characteristic clinical manifestation are important. Cushing's syndrome leads to a redistribution of body fat, causing a round, puffy face, moon face, and fat accumulation on the upper back, buffalo hump. Other common signs include weight gain, not loss, thinning skin, easy bruising, and increased blood pressure. Increased skin pigmentation, B, is more typical of Addison's disease, adrenal insufficiency. Hypotension, D, is also associated with adrenal insufficiency, not excess cortisol. For example, the excess cortisol causes fat to deposit in unusual places like the face and upper back. Here's an easy way to remember it. Cushing's syndrome often makes your face look puffy and creates a fatty hump between your shoulders. Question 44. A nurse is caring for a client with a peripheral intravenous, 4, catheter. The nurse notices redness, swelling, and warmth at the insertion site, and the client reports pain. These signs and symptoms are most suggestive of which complication? A. Infiltration. B. Phlebitis. C. Extravasation. D. Air embolism. Answer, B. Phlebitis. This question addresses complications related to intravenous therapy. The keywords peripheral intravenous, 4, catheter and redness, swelling, and warmth at the insertion site, and the client reports pain are indicative of phlebitis. Phlebitis is inflammation of the vein, often caused by the forecatheter itself or the solution being infused. Infiltration, A, involves leakage of fore fluid into the surrounding tissue, characterized by swelling and coolness, not warmth. Extravasation, C, is a more severe form of infiltration where a vesicant, tissue-damaging, solution leaks. Air embolism, D, is a rare but serious complication where air enters the bloodstream. For example, the forecatheter irritating the vein wall causes inflammation. Here's an easy way to remember it. Redness, warmth, swelling, and pain at an foresight mean the vein itself is probably inflamed. Question 45. A nurse is caring for a client with a history of gout. The nurse should instruct the client to limit intake of which of the following foods? A. Low-fat milk. B. Cherries. C. Organ meats. D. Complex carbohydrates. Answer, C. Organ meats. This question focuses on dietary recommendations for managing gout, a type of inflammatory arthritis caused by the buildup of uric acid crystals in the joints. The keywords gout and limit intake are crucial. Organ meats, such as liver, kidneys, and sweetbreads, are very high in purines, which the body breaks down into uric acid. Limiting purine-rich foods is essential for preventing gout attacks. Low-fat milk, A, cherries, B, and complex carbohydrates, D, are generally considered beneficial or neutral for gout management. For example, eating liver increases the amount of purines in your body, which can then turn into uric acid and form crystals. Here's an easy way to remember it. Foods high in purines, especially organ meats, can trigger gout attacks. Question 46. A nurse is administering a medication intravenously. Which of the following is the most appropriate size needle for administering intravenous fluids at a moderate rate? A. 14 gauge. B. 18 gauge. C. 22 gauge. D. 25 gauge. Answer, B. 18 gauge. This question deals with selecting the appropriate gauge needle for intravenous therapy. The keywords intravenous and moderate rate are important. Needle gauge refers to the diameter of the needle. A smaller gauge number indicates a larger diameter. An 18 gauge needle is commonly used for administering 4 fluids at a moderate to rapid rate, as it allows for adequate fluid flow. 14 gauge needles are very large and typically used for rapid fluid resuscitation or blood transfusions. 22 gauge and 25 gauge needles are smaller and used for slower infusions or for clients with fragile veins, but may not allow for a moderate rate of infusion as effectively. For example, an 18 gauge needle allows a good volume of fluid to pass through quickly without causing significant vein damage. Here's an easy way to remember it. For fluids flowing at a normal pace, an 18 gauge needle is usually the right size. Question 47. A nurse is assessing a client who is postoperative following abdominal surgery. The client reports increased abdominal distension and a feeling of fullness, with no bowel sounds heard on auscultation. Which of the following complications should the nurse suspect? A. Wound infection. B. Deep vein thrombosis. C. Paralytic ileus. D. Urinary retention. Answer, C. Paralytic ileus. This question requires identifying a postoperative complication based on the described symptoms. The keywords postoperative following abdominal surgery and the findings increased abdominal distension, feeling of fullness, and no bowel sounds heard on auscultation are classic signs of paralytic ileus. Paralytic ileus occurs when the normal muscular contractions of the intestines, peristalsis, stop, preventing the passage of intestinal contents. Wound infection, A, typically involves redness, warmth, and drainage at the incision. DVT, B, would involve leg swelling or pain. Urinary retention, D, would manifest as an inability to void. For example, The surgery and anesthesia can temporarily shut down the normal movement of the intestines. Here's an easy way to remember it. If your belly is swollen, feels full, and you can't hear any gut sounds after surgery, it might be that your intestines have temporarily stopped moving. Question 48. A nurse is caring for a client with type 1 diabetes mellitus. Which of the following is the most critical instruction for the client to follow regarding insulin administration? A. Rotate injection sites. B. Store insulin in the refrigerator. C. Mix long-acting insulin with short-acting insulin. D. Administer insulin at room temperature. Answer: A. Rotate injection sites. This question focuses on essential self-management techniques for clients with type 1 diabetes who use insulin. The keywords type 1 diabetes mellitus and critical instruction are important. Rotating injection sites is crucial to prevent lipohypertrophy, thickening of subcutaneous fat, or lipoatrophy, loss of subcutaneous fat, at the injection site, which can affect insulin absorption and glycemic control. While storing insulin properly, B, and administering it at room temperature, D, are important for efficacy, site rotation directly impacts absorption consistency. Mixing long-acting and short-acting insulin, C, is generally not recommended unless specifically instructed by a healthcare provider, as it can alter the pharmacokinetic profiles of the insulins. For example, repeatedly injecting into the same spot can create lumps that prevent insulin from being absorbed properly. Here's an easy way to remember it. To make sure your insulin works its best, always switch up where you give yourself the shot. Question 49. A nurse is assessing a client experiencing symptoms of hypovolemic shock. Which of the following vital sign findings would the nurse expect? A. Bradycardia and hypotension. B. Tachycardia and hypotension. C. Bradycardia and hypertension. D. Tachycardia and hypertension. Answer: B. Tachycardia and hypotension. This question tests the understanding of the typical vital sign changes seen in hypovolemic shock, a condition where the body loses a significant amount of fluid or blood. The keywords hypovolemic shock and vital sign findings are critical. In hypovolemic shock, the body tries to compensate for the reduced blood volume by increasing the heart rate, tachycardia, to pump the remaining blood more efficiently, and by decreasing blood pressure, hypotension, because there isn't enough fluid to maintain adequate pressure. Bradycardia, slow heart rate, and hypertension, high blood pressure, are not characteristic of hypovolemic shock. For example, the heart beats faster to try and push the reduced amount of blood around the body to keep organs supplied with oxygen. Here's an easy way to remember it. When you're losing too much fluid, your heart beats faster and your blood pressure drops. Question 50. A nurse is caring for a client with a tracheostomy. Which of the following actions is most important to prevent dislodgement of the tracheostomy tube? A. Suctioning the tracheostomy as needed. B. Ensuring the tracheostomy ties are secure but not too tight. C. Administering humidified air. D. Performing tracheostomy site care daily. Answer: B. Ensuring the tracheostomy ties are secure but not too tight. This question focuses on preventing a critical complication of tracheostomy care, dislodgement. The keywords tracheostomy and prevent dislodgement are crucial. The ties securing the tracheostomy tube to the client's neck are the primary physical barrier against accidental removal. If they are too loose, the tube can easily be pulled out. If they are too tight, they can cause skin breakdown or obstruct blood flow. Suctioning, A, humidified air, C, and site care, D, are important for maintaining the airway and preventing infection but do not directly address the physical security of the tube. For example, if the ties are too loose, the tube could be accidentally tugged out during repositioning or cleaning. Here's an easy way to remember it. The ties holding the tracheostomy in place need to be snug but comfortable to keep the tube from falling out. Question 51. A nurse is caring for a client with iron deficiency anemia. Which of the following dietary recommendations would be most beneficial for increasing iron absorption? A. Consuming milk with iron-rich foods. B. Drinking a glass of orange juice with iron supplements. C. Taking iron supplements with antacids. D. Eating a large serving of calcium-rich vegetables with iron supplements. Answer B. Drinking a glass of orange juice with iron supplements. This question tests knowledge about enhancing iron absorption through diet. The keywords iron deficiency anemia and increasing iron absorption are important. Vitamin C, found in orange juice, significantly enhances the absorption of non-heme iron, the type found in plant-based foods and iron supplements. Milk, A, contains calcium, which can inhibit iron absorption. Antacids, C, can also interfere with iron absorption. While calcium-rich vegetables, D, are healthy, the presence of calcium can hinder iron absorption, and pairing them with iron supplements is less effective than pairing with vitamin C. For example, vitamin C helps your body absorb iron more easily from your stomach. Here's an easy way to remember it. Vitamin C, found in citrus juices, is a great helper for your body to absorb iron. Question 52. A nurse is assessing a client who has undergone a transurethral resection of the prostate, TURP. The client has a continuous bladder irrigation, CBI, in place. The nurse should monitor for which of the following signs that the irrigation system may be occluded? A. Clear, pink-tinged urine output. B. Decreased urine output or blood clots in the urine. C. Bright red urine output with no clots. D. Increased urine output. Answer B. Decreased urine output or blood clots in the urine. This question focuses on monitoring a client with a continuous bladder irrigation, CBI, after a TURP. The keywords transurethral resection of the prostate, TURP, and occluded are critical. After a TURP, CBI is used to prevent blood clots from obstructing the urethra. If the irrigation system becomes occluded, blockade, the flow of irrigating fluid stops, leading to a decrease in urine output and the potential for blood clots to accumulate and block the bladder or catheter. Clear, pink-tinged urine, A, indicates the irrigation is working effectively. Bright red urine, C, might indicate active bleeding but not necessarily occlusion. Increased urine output, D, is also not a sign of occlusion. For example, if the tube carrying the fluid gets kinked, no fluid can get through to wash out the blood. Here's an easy way to remember it. If you see less urine coming out or if it looks like a lot of clots are forming, the bladder irrigation might be blocked. Question 53. A nurse is caring for a client with Addison's disease. Which of the following hormones would the nurse expect to be deficient? A. Cortisol. B. Aldosterone. C. Thyroid-stimulating hormone, TSH. D. Antidiuretic hormone, ADH. Answer A. Cortisol. This question tests knowledge of Addison's disease, a disorder where the adrenal glands do not produce enough steroid hormones. The keywords Addison's disease and hormones deficient are important. The adrenal glands produce several hormones, including cortisol and aldosterone. Addison's disease primarily involves a deficiency in cortisol and often aldosterone. TSH, thyroid-stimulating hormone, is produced by the pituitary gland and affects the thyroid gland, not the adrenal glands. ADH, antidiuretic hormone, is produced by the hypothalamus and released by the pituitary gland and regulates water balance. Therefore, cortisol deficiency is the most direct answer. For example, the adrenal glands are responsible for making cortisol, which helps the body manage stress and blood sugar. Here's an easy way to remember it. In Addison's disease, the adrenal glands aren't making enough of the important hormone cortisol. Question 54. A nurse is caring for a client who has received a recent blood transfusion and is now complaining of itching and hives. Which of the following actions should the nurse take first? A. Administer an antihistamine. B. Stop the blood transfusion. C. Increase the rate of infusion. D. Document the findings. Answer, B. Stop the blood transfusion. This question concerns recognizing and responding to a potential blood transfusion reaction. The keywords recent blood transfusion and itching and hives are key signs of an allergic reaction. According to safety protocols, the immediate action upon suspecting a transfusion reaction is to stop the transfusion to prevent further exposure to the causative agent. Administering an antihistamine, A, might be part of the treatment plan, but only after the transfusion is stopped. Increasing the infusion rate, C, would be dangerous, and documenting, D, is important but secondary to stopping the transfusion. For example, the itching and hives indicate the body is reacting negatively to the blood being given. Here's an easy way to remember it. If you suspect a bad reaction to a blood transfusion, stop it immediately before doing anything else. Question 55. A nurse is caring for a client with anemia. The client asks why they are experiencing fatigue and shortness of breath. The nurse should explain that these symptoms are primarily due to A. Decreased red blood cell count. B. Increased white blood cell count. C. Decreased platelet count. D. Increased blood viscosity. Answer, A. Decreased red blood cell count. This question asks for the underlying reason for fatigue and shortness of breath in anemia. The keywords anemia and fatigue and shortness of breath are important. Anemia is a condition characterized by a deficiency of red blood cells or hemoglobin, which are responsible for carrying oxygen throughout the body. A decreased red blood cell count means less oxygen can be delivered to the body's tissues, leading to fatigue and shortness of breath. Increased white blood cells, B, are associated with infection or inflammation. Decreased platelets, C, affect clotting. Increased blood viscosity, D, is not typically a primary symptom of anemia. Rather, the blood is often less viscous due to fewer red blood cells. For example, if you don't have enough red blood cells, your muscles and brain won't get enough oxygen. Here's an easy way to remember it. Anemia means not enough oxygen carriers, which is why you feel tired and can't breathe easily. Question 56. A nurse is caring for a client with a history of peptic ulcer disease, PUD. The nurse should teach the client to avoid which of the following beverages that can exacerbate PUD? A. Water. B. Milk. C. Coffee. D. Herbal tea. Answer, C. Coffee. This question focuses on dietary triggers for peptic ulcer disease, PUD, which involves sores in the lining of the stomach or duodenum. The keywords peptic ulcer disease and exacerbate are crucial. Coffee, particularly caffeinated coffee, contains compounds that can stimulate gastric acid secretion, which can irritate existing ulcers and worsen symptoms. Water, A, is neutral. Milk, B, was historically thought to be helpful, but it can stimulate rebound acid production. Herbal teas, D, are generally considered safe, though some might be acidic. For example, the caffeine and acidity in coffee can increase the amount of acid in the stomach, irritating the ulcer. Here's an easy way to remember it. Coffee can be tough on your stomach if you have ulcers because it makes more acid. Question 57. A nurse is assessing a client who is receiving heparin therapy for deep vein thrombosis, DVT. Which of the following laboratory values should the nurse monitor to assess the therapeutic effect of heparin? A. Prothrombin time, PT. B. International Normalized Ratio, INR. C. Activated Partial Thromboplastin Time, APTT. D. Platelet count. Answer, C. Activated Partial Thromboplastin Time, APTT. This question tests the understanding of how to monitor the effectiveness of heparin therapy. The keywords heparin therapy and therapeutic effect are important. Heparin is an anticoagulant that works by activating antithrombin 3, which inhibits factors in the intrinsic pathway of the coagulation cascade. The activated partial thromboplastin time, APTT, is the laboratory test that specifically measures the intrinsic pathway and is used to monitor heparin's therapeutic range. Prothrombin time, PT, and INR, B, are used to monitor warfarin therapy. Platelet count, D, is monitored for potential heparin-induced thrombocytopenia, HIT, a serious side effect, but not for the therapeutic effect of anticoagulation itself. For example, APTT measures how long it takes blood to clot under certain conditions, and heparin prolongs this time. Here's an easy way to remember it. For heparin, the key lab test to watch is the APTT. Question 58. A nurse is caring for a client who is post-operative from a hip replacement. The nurse should instruct the client to avoid which of the following positions? A. Supine position with head of bed elevated. B. Side-lying position with pillows between the legs. C. Sitting in a high-backed chair. D. Crossing the legs. Answer, D. Crossing the legs. This question focuses on preventing complications after a hip replacement. The keywords hip replacement and avoid which of the following positions are crucial. Crossing the legs, option D, is a position that can lead to hip adduction and internal rotation, which increases the risk of dislocating the new hip prosthesis. The other positions are generally encouraged or safe. The supine position, A, with head elevated is common, side-lying with pillows between the legs, B, maintains proper alignment and prevents adduction, and sitting in a high-backed chair, C, can be comfortable. For example, crossing your legs puts your hip joint in a position where the new ball and socket joint can easily pop out. Here's an easy way to remember it. Keep your legs uncrossed after a hip replacement to keep your new hip in place. Question 59. A nurse is caring for a client with hypothyroidism. Which of the following symptoms would the nurse expect the client to exhibit? A. Tachycardia. B. Weight loss. C. Heat intolerance. D. Dry, coarse skin. Answer, D. Dry, coarse skin. This question assesses the typical symptoms of hypothyroidism, a condition where the thyroid gland doesn't produce enough thyroid hormone, slowing down the body's metabolism. The keywords hypothyroidism and expect the client to exhibit are important. A hallmark of hypothyroidism is the effect on the skin, leading to dryness, coarseness, and sometimes swelling, myxedema. Tachycardia, fast heart rate, A, and heat intolerance, C, are symptoms of hyperthyroidism, overactive thyroid E. Weight loss, B, is also associated with hyperthyroidism. Clients with hypothyroidism often experience weight gain. For example, the lack of thyroid hormone slows down bodily processes, including skin cell turnover. Here's an easy way to remember it. When your thyroid is underactive, your skin often becomes very dry and rough. Question 60. A nurse is caring for a client with suspected appendicitis. Which of the following assessment findings is most indicative of appendicitis? A. Diarrhea and periumbilical pain. B. Constipation and generalized abdominal pain. C. Right lower quadrant pain with rebound tenderness. D. Left lower quadrant pain with nausea. Answer, C. Right lower quadrant pain with rebound tenderness. This question focuses on the classic signs and symptoms of appendicitis, inflammation of the appendix. The keywords suspected appendicitis and most indicative are crucial. The classic presentation includes periumbilical pain that migrates to the right lower quadrant, RLQ, along with anorexia, nausea, and vomiting. Rebound tenderness, pain that worsens when pressure is released in the RLQ, is a highly suggestive sign of peritoneal irritation, often caused by appendicitis. Diarrhea, A, is less common. Constipation, B, can occur but is not the primary indicator, and left lower quadrant pain, D, points to other issues. For example, when the inflamed appendix irritates the lining of the abdomen, pressing and then quickly releasing the pressure causes sharp pain. Here's an easy way to remember it. Pain in the lower right belly that hurts more when you let go of the pressure is a strong sign of appendicitis. Question 61. A nurse is caring for a client who is prescribed warfarin. The client reports a large bruise on their arm after bumping into a table. The nurse should reinforce which of the following teaching points? A. Warfarin can increase the risk of bruising. B. The client should stop taking warfarin immediately. C. The client should increase their intake of vitamin K. D. The client should contact their healthcare provider only if bleeding is severe. Answer: A. Warfarin can increase the risk of bruising. This question addresses the expected side effects of warfarin, an anticoagulant medication. The keywords warfarin and bruise on their arm after bumping into a table are important. Warfarin works by thinning the blood, making it less likely to clot. A common consequence of this is an increased tendency to bruise easily, even from minor trauma. Stopping warfarin immediately, B, without medical advice can be dangerous, and increasing vitamin K intake, C, would counteract warfarin's effect. Contacting the provider only for severe bleeding, D, is incorrect. Any concerning signs of bleeding should be reported. For example, because warfarin makes your blood thinner, it doesn't take much to make a bruise form. Here's an easy way to remember it. Bruising easily is a common side effect of warfarin because it thins your blood. Question 62. A nurse is caring for a client with a history of asthma who is experiencing wheezing and shortness of breath. Which of the following medications should the nurse anticipate administering to provide rapid relief of bronchospasm? A. Fluticasone. B. Montelukast. C. Albuterol. D. Prednisone. Answer: C. Albuterol. This question asks to identify the most appropriate medication for rapid relief of bronchospasm in a client with asthma. The keywords asthma, wheezing, shortness of breath, and rapid relief are critical. Albuterol is a short-acting beta agonist, SABA, that works quickly to relax the smooth muscles of the airways, opening them up and relieving bronchospasm. Fluticasone, A, is an inhaled corticosteroid used for long-term control of inflammation. Montelukast, B, is a leukotriene modifier, also for long-term control. Prednisone, D, is an oral corticosteroid that is used to reduce inflammation but takes longer to work than ASABA for immediate relief. For example, when someone with asthma is actively wheezing, albuterol is the go-to medication to open their airways quickly. Here's an easy way to remember it. For quick asthma relief, you need a rescue inhaler like albuterol. Question 63. A nurse is caring for a client with a new diagnosis of hyperthyroidism. The nurse should instruct the client to increase their intake of which of the following nutrients? A. Iodine. B. Calcium. C. Iron. D. Vitamin D. Answer, C. Iron. This question focuses on nutritional considerations for a client with hyperthyroidism. The keywords hyperthyroidism and increase their intake of which nutrient are important. Hyperthyroidism increases the body's metabolic rate, which can lead to increased calorie and nutrient needs, including iron, as it can contribute to elevated energy expenditure and potential loss of certain nutrients. While iodine is essential for thyroid hormone production, an excess can be problematic in hyperthyroidism. Calcium and vitamin D, B, D are important for bone health, but iron deficiency can be a concern due to increased metabolism. Iron is essential for energy production, and clients with increased metabolism may require more. For example, the body's increased metabolism can use up iron stores faster. Here's an easy way to remember it. With an overactive thyroid, your body burns energy faster, so it's important to make sure you have enough iron. Question 64. A nurse is caring for a client who is experiencing syncope. Which of the following assessments is the nurse's priority? A. Assess pupil response to light. B. Assess skin turgor. C. Assess blood glucose level. D. Assess heart rate and blood pressure. Answer, D. Assess heart rate and blood pressure. Syncope, or fainting, is often caused by a temporary lack of blood flow to the brain, which is commonly related to cardiovascular issues. The keywords syncope and priority assessment are critical. Assessing heart rate and blood pressure, option D, provides immediate information about the client's hemodynamic status and potential causes like bradycardia, tachycardia, or hypotension. Pupil response to light, A, is important for neurological assessment but not the immediate priority for syncope. Skin turgor, B, indicates hydration status. Blood glucose level, C, is important for diabetic clients but not the first step for general syncope unless the client has a known history of hypoglycemia. For example, a sudden drop in blood pressure can cause you to pass out. Here's an easy way to remember it. When someone faints, checking their pulse and blood pressure right away tells you a lot about why it happened. Question 65. A nurse is caring for a client receiving chemotherapy. The client develops mucositis, characterized by inflammation and ulceration of the mucous membranes. Which of the following interventions is most appropriate for managing mucositis? A. Administering a mouth rinse containing alcohol. B. Encouraging frequent, small sips of hot liquids. C. Providing a soft toothbrush and gentle oral hygiene. D. Restricting fluid intake to prevent oral discomfort. Answer, C. Providing a soft toothbrush and gentle oral hygiene. This question focuses on managing mucositis, a common side effect of chemotherapy that causes painful sores in the mouth. The keywords chemotherapy and mucositis are important. Gentle oral care with a soft toothbrush, option C, helps to keep the mouth clean, reduce bacteria, and prevent further irritation or infection. Mouth rinses containing alcohol, A, can further irritate and dry out the inflamed tissues. Hot liquids, B, can also exacerbate pain and inflammation. Restricting fluid intake, D, is counterproductive. Adequate hydration is essential. For example, using a soft brush and gentle technique helps clean the mouth without damaging the sensitive, ulcerated tissues. Here's an easy way to remember it. When your mouth is sore from treatment, gentle cleaning with a soft brush is the key to keeping it healthy. Question 66. A nurse is caring for a client with type 2 diabetes mellitus. The client asks what causes the disease. The nurse should explain that type 2 diabetes is primarily characterized by A, the pancreas producing no insulin. B, the body's inability to produce enough insulin. C, the body's cells becoming resistant to insulin. D, an autoimmune destruction of the pancreas. Answer, C, the body's cells becoming resistant to insulin. This question asks for the primary mechanism of type 2 diabetes mellitus. The keywords type 2 diabetes mellitus and characterized by are crucial. Type 2 diabetes is primarily an issue of insulin resistance, where the body's cells do not respond effectively to insulin. While the pancreas may eventually be unable to produce enough insulin to overcome this resistance, the initial and primary problem is resistance. Type 1 diabetes, A, D, is characterized by the pancreas producing little to no insulin, often due to autoimmune destruction. For example, in type 2 diabetes, even though there's insulin, the locks on the body's cells that insulin fits into don't work properly. Here's an easy way to remember it. Type 2 diabetes is mostly about your body's cells not responding well to insulin. Question 67. A nurse is caring for a client who has undergone a cholecystectomy, gallbladder removal. The client is reporting pain in the right shoulder. The nurse should explain that this pain is likely due to A, infection at the incision site. B, referred pain from diaphragmatic irritation. C, deep vein thrombosis in the leg. D, constipation. Answer, B, referred pain from diaphragmatic irritation. This question addresses a common postoperative symptom after laparoscopic cholecystectomy. The keywords cholecystectomy and pain in the right shoulder are important. During laparoscopic surgery, carbon dioxide is used to inflate the abdomen, which can irritate the diaphragm. The diaphragm shares nerve pathways with the shoulder area, causing pain to be perceived in the shoulder, known as referred pain. This is usually transient and resolves as the CO2 is absorbed. Infection, A, would typically present with fever, redness, and drainage at the incision. DVT, C, would cause leg pain or swelling. Constipation, D, can cause abdominal discomfort but not typically shoulder pain. For example, the gas used to inflate the abdomen can irritate the diaphragm, and your brain interprets that irritation as pain in your shoulder. Here's an easy way to remember it. Shoulder pain after this type of surgery is common because the gas used can irritate nerves connected to your shoulder. Question 68. A nurse is caring for a client with acute kidney injury, AKI. The nurse should monitor which of the following laboratory values that may be elevated in AKI? A, serum calcium. B, serum bicarbonate. C, blood urea nitrogen, BUN. D, hemoglobin. Answer, C, blood urea nitrogen, BUN. This question focuses on identifying a key laboratory indicator of acute kidney injury, AKI. The keywords acute kidney injury and elevated are crucial. The kidney's primary role is to filter waste products from the blood, including urea. When kidney function declines, urea is not effectively removed, leading to an increase in blood urea nitrogen, BUN, levels. Serum calcium, A, typically decreases in AKI, serum bicarbonate, B, also decreases due to metabolic acidosis, and hemoglobin, D, may decrease if AKI is associated with chronic kidney disease or anemia. For example, when the kidneys can't filter waste properly, toxins like urea build up in the blood. Here's an easy way to remember it. If your kidneys aren't working well, the waste product BUN will build up in your blood. Question 69. A nurse is caring for a client who has undergone a total hip arthroplasty. Which of the following is a priority nursing intervention to prevent postoperative complications? A. Administering pain medication every 4 hours. B. Encouraging ambulation within 24 hours. C. Monitoring for signs of deep vein thrombosis, DVT. D. Providing a low-sodium diet. Answer, C. Monitoring for signs of deep vein thrombosis, DVT. This question addresses a significant postoperative complication after hip arthroplasty. The keywords total hip arthroplasty and prevent postoperative complications are important. Immobility following hip surgery increases the risk of DVT, a blood clot in the leg veins. Monitoring for signs of DVT, e.g., leg pain, swelling, redness, warmth, is a priority intervention. While pain management, A, early ambulation, B, and diet, D, are important aspects of care, preventing DVT is a critical safety measure directly related to the surgical procedure and immobility. For example, blood can pool in the legs after surgery, forming clots that could travel to the lungs. Here's an easy way to remember it. After a hip replacement, watch closely for signs of leg clots because they are a serious risk. Question 70. A nurse is caring for a client receiving a continuous infusion of an opioid analgesic for pain management. The nurse should monitor for which of the following adverse effects that indicates excessive dosing or toxicity. A. Increased alertness. B. Decreased respiratory rate. C. Increased bowel motility. D. Dilated pupils. Answer, B. Decreased respiratory rate. This question focuses on identifying an adverse effect of opioid analgesics that signals toxicity or excessive dosing. The keywords opioid analgesic and excessive dosing or toxicity are critical. Opioids are central nervous system depressants, and a significant adverse effect of overadministration is respiratory depression, characterized by a slowed and shallow respiratory rate. Increased alertness, A, is the opposite of an opioid effect. Increased bowel motility, C, is also the opposite. Opioids typically cause constipation by slowing bowel movements. Dilated pupils, D, are a sign of opioid withdrawal or anticholinergic effects, not toxicity. For example, taking too much opioid can slow down your breathing to a dangerous level. Here's an easy way to remember it. The most dangerous sign of too much opioid is when your breathing slows down significantly. Question 71. A nurse is caring for a client with a diagnosis of asthma. The client is asking about long-term management. Which of the following types of medications is primarily used for long-term control of asthma symptoms? A. Short-acting beta agonist, SABA. B. Oral corticosteroid. C. Leukotriene modifier. D. Bronchodilator. Answer, C. Leukotriene modifier. This question differentiates between medications for acute relief and long-term control of asthma. The keywords asthma and long-term control are essential. Leukotriene modifiers, like Monteliacast, help reduce airway inflammation and prevent bronchoconstriction over time, making them important for long-term management. Short-acting beta agonists, SABAs, are rescue inhalers for immediate relief of bronchospasm. Oral corticosteroids, B, are used for severe exacerbations and sometimes long-term control but are associated with more side effects. Bronchodilators, D, is a broad category, while SABAs are bronchodilators. Bronchodilator alone doesn't specify long-term control, as many are short-acting. For example, leukotriene modifiers help calm down the underlying inflammation that causes asthma attacks. Here's an easy way to remember it. For keeping asthma under control day to day, medications like leukotriene modifiers are key. Question 72. A nurse is caring for a client with severe burns. The nurse should prioritize which of the following in the initial management of burns? A. Administering pain medication. B. Preventing infection. C. Ensuring adequate fluid resuscitation. D. Wound debridement. Answer, C. Ensuring adequate fluid resuscitation. This question addresses the critical initial priorities in managing severe burns. The keywords severe burns and initial management are crucial. In the first 24 to 48 hours after a severe burn, significant fluid shifts occur, leading to potential hypovolemic shock. Therefore, ensuring adequate fluid resuscitation, intravenous fluid replacement, is the most critical initial intervention to maintain circulating volume and organ perfusion. While pain management, A, preventing infection, B, and wound debridement, D, are all important aspects of burn care, they are secondary to addressing the immediate life-threatening fluid loss. For example, the body loses a lot of fluid through the damaged skin, and giving 4 fluids quickly helps replace it. Here's an easy way to remember it. For severe burns, the absolute first thing to focus on is replacing the fluids the body is losing. Question 73. A nurse is assessing a client with Cushing's syndrome. Which of the following laboratory tests would the nurse expect to be elevated? A. Potassium. B. Sodium. C. Glucose. D. Hemoglobin. Answer, C. Glucose. This question tests the knowledge of the hormonal effects of Cushing's syndrome, which is caused by excess cortisol. The keywords Cushing's syndrome and elevated laboratory test are important. Cortisol has a diabetogenic effect, meaning it increases blood glucose levels by promoting gluconeogenesis, the production of glucose from non-carbohydrate sources, and decreasing glucose uptake by cells. Therefore, elevated glucose, hyperglycemia, is a common finding. Potassium, A, is often low in Cushing's syndrome due to the mineralocorticoid effects of excess cortisol. Sodium, B, may be slightly elevated. Hemoglobin, D, is not typically directly affected, though polycythemia can occur in some cases. For example, the excess cortisol makes the body more resistant to insulin, causing blood sugar to rise. Here's an easy way to remember it. The excess cortisol in Cushing's syndrome often makes your blood sugar levels go up. Question 74. A nurse is caring for a client with a new diagnosis of shingles, herpes zoster. Which of the following is the most important instruction to provide regarding transmission of the virus? A. The client should avoid contact with pregnant women. B. The client should cover the rash with clothing. C. The client should wash their hands frequently. D. The client should avoid contact with anyone who has not had chickenpox. Answer, D. The client should avoid contact with anyone who has not had chickenpox. This question addresses the transmission precautions for shingles. The keywords shingles and transmission of the virus are critical. Shingles is caused by the reactivation of the varicella-zoster virus, VZV, the same virus that causes chickenpox. While shingles itself is not directly contagious, the VZV can be transmitted from an infected person to someone who has not had chickenpox or the chickenpox vaccine, causing them to develop chickenpox. Therefore, the most important instruction is to avoid contact with susceptible individuals. Covering the rash, B, helps prevent direct contact but doesn't eliminate risk. Handwashing, C, is good practice but not the primary transmission prevention for VZV from shingles. Pregnant women, A, are a specific group to consider due to risk of congenital varicella if they haven't had chickenpox, but the broader risk is to anyone unvaccinated. For example, if you have shingles and someone who never had chickenpox touches your rash, they can catch the virus and get chickenpox. Here's an easy way to remember it. People with shingles can give chickenpox to those who haven't had it before, so avoid those individuals. Question 75. A nurse is caring for a client who is experiencing symptoms of an electrolyte imbalance, specifically hyponatremia, low sodium levels. Which of the following symptoms would the nurse expect to assess? A. Muscle weakness and cramps. B. Increased urine output. C. Dry mucous membranes. D. Bradycardia. Answer: A. Muscle weakness and cramps. This question focuses on the clinical manifestations of hyponatremia, a condition where sodium levels in the blood are too low. The keywords electrolyte imbalance and hyponatremia are important. Sodium plays a crucial role in nerve and muscle function. Low sodium levels can disrupt the electrical potential across cell membranes, leading to symptoms like muscle weakness, fatigue, and cramps. Increased urine output, B, is not a direct symptom of hyponatremia, and dry mucous membranes, C, and bradycardia, D, are more commonly associated with dehydration or hypovolemia. For example, sodium is important for muscles to contract properly, so low levels can cause them to feel weak or cramp. Here's an easy way to remember it. Low sodium levels can make your muscles feel weak and cramp up because sodium is vital for muscle function.